Okay, we're going to test the medial collateral and lateral collateral ligaments of the knee. Varus and valgus stress test. I'm going to do valgus first. I'm just going to palpate the joint line. There's the medial collateral ligament. Bring the knee up a little bit. With my left hand, I'm going to just be slightly above the knee, and this is an arcing, so it's an arcing movement. My right hand is going to create a movement towards my body, and my left hand is going to stabilize just above the knee to put pressure on that medial collateral ligament. Okay, a little gapping there, and then I can take it into about 20 degrees of flexion, and I can gap it, try the gapping test or the valgus test there to test the medial collateral ligament. The varus, again, is done the same way, except I'm applying force medially with my right hand. I'm going to apply a medial force. I'm going to reposition my hands a little bit, and so I'm going to do it in full knee extension. So I'm trying to stabilize here with my left, gap the lateral collateral ligament, and then I can flex the knee a little bit and do varus, gapping the lateral collateral ligament, looking for hypermobility and stability of those ligaments. We're testing we're doing the anterior and posterior drawer test. And with the anterior drawer test, we're looking at the shelf of the tibia. We're looking at how much the shelf of the tibia moves forward off of the condyles of the femur. We're testing the anterior cruciate ligament with an anterior drawer test. So it's pulling forward. It's exactly the same as a sustained grade 2 joint play, but it's called the anterior drawer test, specifically targeting the anterior cruciate ligament. Now the posterior drawer test is applying in a posterior direction, testing the posterior cruciate ligament, looking for hypermobility or instability. So you're looking at the shelf of the tibia right through here, moving posteriorly or anteriorly. So you're looking at, and you compare one side to the other. You always test the normal side to see what normal is, and then test the affected side. Okay, we're going to do the bounce test, bounce sign. The bounce sign tests for meniscus tears in the medial lateral aspect of the knee. So what we do, we take the knee to about 20-30 degrees, and we simply let it drop. And what we're looking for is a springing infield or a locking, or the knee doesn't completely lock. It stops at about 5 or 8 degrees of flexion and deflection, and a springy infield or a sensation of pain or clicking or snapping on the medial, more the medial side or the lateral side, looking for a meniscus tear. Okay, we're doing McMurray's test here. There's a couple different ways of doing it. You can simply, testing for the medial meniscus, is testing for meniscus tears or lesions. So you can externally rotate the tibia on the head of or the distal end of the femur here, the knee, and do a valgus push with the left hand in and extend the leg, looking for a click, snap, or popping sensation. Or you can do it in a little bit at a time. So you take it up to full flexion, externally rotate the tibia, and do a little bit of back and forth so the foot goes in neutral, external rotation of valgus, external rotation of valgus, external rotation of valgus, checking different vectors of the joint. You can also do the opposite. You can immediately rotate the tibia, do a varus stress, and bring the leg out into extension this way. And extend. The other way is simply doing it, bring it up, externally rotate, bring it out with a valgus stress, and then bring it up full flexion, immediately rotate the tibia, and bring it up with a varus stress into extension. Looking for snapping, popping, or clicking, stressing the meniscus and the medial lateral aspect of the knee. Okay, we're testing the patella for patella femoral syndrome, or inflammation of the undersurface of the patella and the facets of the patella. So what we're going to do is we're going to take our left hand, I'm going to apply pressure down on the patella in a downward direction. I'm going to hold that, and I'm going to ask my client to contract the quads slowly. That's it. Hold that and release. Now, it's considered positive if the person recreates the pain the person's been having on the lateral aspect of the patella or the knee in general. So again, you hold the patella, compress it down, have the person do a nice contraction, and hold and relax. Good. Okay, this is a patella femoral compression. It can be done a couple different ways. You can do this with a person standing and then bending with pressure on the patella. We're going to show it in a passive movement with a person in supine position. Take the knee up into flexion. Put your left or right hand over top of the patella. Apply pressure and extend. So what you're looking for is a recreation of the person's pain they've been having related to patella femoral, or you're looking for a lot of crepitus in pain. So applying pressure to the patella in a downward direction and extending and flexing. Okay, this test is to test for extra fluid or interstitial fluid or joint effusion on the medial aspect of the knee. It's a brushstroke test. So I'm going to do some movements, effleurage movements up towards the hip 3 or 4 times. And then with the other hand, I'm going to bring the other hand down in the inferior direction. And what you're looking for is excess fluid build up on the medial aspect of the knee through this region here, joint effusion or excess fluid.